Hello, everybody. We have another episode. We start in season 9 with a big surprise. And I was very honored that Dr. Diana Zschaschel accepted the invitation to come and talk to us, even though I promised the audience that we're going to go and visit her office and another specialist office. And Dr. Diana Zschaschel, I was really wanted to talk to her because she has a huge academic history background, 3 degrees from UCLA, from her bachelor's, and then she went to dental school. She has a GPR, but is mainly specialized in hospital patients and patients with special needs. And she's been doing this for more than 20 years. And she has a private practice here in Beverly Hills Close. And you can, if you have any questions about that, you can always send it to the program, but I want Dr. Diana Zschaschel. Talk about, hello, Dr. Zschaschel.
Thank you, Dr. Yacaman, for inviting me. It's really an honor to know you for so long. We've been I've been very fortunate. Yeah. It was through really good circumstances that we met. Yeah. For those of you who've never met me before, I'm also in the Army Reserves, and I was deployed.
Yeah, I forgot.
And one of my patients needed a root canal, and found Dr. Yacaman, and being the honorable and ethical doctor she was, she contacted me after I had returned from deployment and said, I treated your patient, but I really want to meet you. It's amazing what you do. And we've become friends ever since. And so I'm very honored to be here. Thank you so much.
I wanted people to know what you do, because it's one of the few dentists that you can count with your fingers that you will not find a doctor that is fully dedicated, mostly her practice, to special needs and have the privilege in the hospital. It's only 2 dentists have privilege in the hospital. That is the City of Hope. And she treats all these patients with disabilities that sometimes they're not treated at the dental office, or some people just don't want to work with that type of patients. But tell me, how is your experience working? I think you have autism, patients with autism, patients with any special needs, mental.
Yeah, I can explain a little more. Yeah, so, as an undergrad, I was an undergrad in psychology, and I was interested in a class on autism research and autism treating with behavioral analysis, and started working with children with autism. I knew I wanted to be a dentist, so once I got into dental school, I made the fortune or misfortune to tell one of my professors that I work with children with autism. I'm a behavioral analyst. And after that, they sent me all these patients with special needs: Down syndrome, intellectual deficits, autism. And so I was able to treat them through some of the techniques I learned through behavioral analysis. And once I became a dentist, I actually went to a postgraduate program in hospital dentistry, where I also saw children with autism, and people with cancer, and worked under general anesthesia as well. So I sort of started dedicating time in my practice. I also see patients just like you.
Yes, I am your patient.
Yes. And so it is just a part of my practice. But you're right, I'm one of a very small handful that will see patients that are not seen anywhere else. And so we see patients with Down syndrome, patients with autism. A lot of people don't realize how prevalent autism is. Yeah. It's 1 in every 100 girls have autism, and 1 in every 25 boys. So it's a very prevalent developmental disability. And it's a spectrum. So most people, unless they're very outwardly obvious, their behaviors, you will see a child with autism and you won't even know until they start acting like, oh, they're having a tantrum, but actually what they're having is a meltdown, or they'll be spinning around, or they'll be flapping their hands. And a lot of them have tactile sensitivities, or they have sound sensitivities. So a toothbrush, electric toothbrush will freak them out. A shiny mirror or a shiny object, or just touching in their mouth. Some of them, they won't even allow you to cut their hair. So there's a lot of techniques that I've learned over the years to kind of help treat them in a dental office. And a lot of the things that I do are called desensitization, where I desensitize them to to being treated by me.
Even before the treatment.
Yes, sometimes they'll come in months and months just to sit in my just to sit in an outside chair because they are too afraid to come in. And I get them to trust me.
Yeah.
The good news is once they trust me, they don't want to go anywhere else. So you have a built-in, loyal fan base, right? So it is challenging.
Yeah.
And a lot of people don't have the patience for it. They just don't understand them. So it's something that I feel like I understand. To me, they're like angels. So I understand them. I feel like I understand them implicitly. And I like a lot of times I like them better because they're very open and loving. And they just really, once they're your friends for life.
So I remember you sent me a girl a long time ago that I think was cerebral palsy, because she was saliva dropping, and the sister is a nurse. And she's adorable, but at that time she needed sedation, not to the point to hospital, because that's better. When do you recommend the parents to take a look certain symptoms that the patient can show them that it's time to take it to the physician to have a diagnosis if there's any mental issue?
So a lot of things are noted around under 2. Some things are noted at birth, but for example, with autism, there are some pretty significant milestones that they don't make. They don't usually talk it to, or they'll talk and then they'll stop talking. They'll do things in an OCD type of way. They'll line up cars, or they'll open and close doors, open and close drawers, and only that. They'll repeat what you say. It's called echolalia, where they'll just you'll say, you'll say something to me.
Hello, Diana.
Hello, Diana.
Oh, they repeat.
It's called echolalia, where they just actually repeat what you say, or they'll repeat entire movies, like whole scripts, word for word. And it's quite remarkable.
Because they are very smart, right?
Yes, it has nothing to do with their intellectual, Now, some people with autism happen to have comorbidities, like developmental delays, but for the most part, if it's just, straight autism, they have normal intellects, if not high intellects.